Hello, Namaskar. I am Dr. Murali Manohar. Welcome to my lecture, Ayurveda Samhita. In this program, we will be learning and knowing about an important topic and some powerful ancient Indian Ayurvedic secrets. These can change and improve your entire life. In this program, I am going to talk about the common problem, urinary incontinence. How can we define this condition? Urinary incontinence, the loss of bladder control, is a common and often embracing problem. The severity ranges from occasionally leaking urine when you cough or sneeze to having an urge to urinate that's so sudden and strong you don't get to a toilet in time. If urinary incontinence affects your daily activities, don't hesitate to take medical advice. For most people, simple lifestyle changes, Ayurvedic medical treatment or Panchakarma treatment can ease discomfort or stop urinary incontinence. Then let us know about the most important thing, symptoms. Some people experience occasional minor leaks of urine. Others wet their clothes frequently. Now let us know about the different types of urinary incontinence. Based on the presentation of symptoms, urinary incontinence can manifest in different types. Let us know one by one. First one, stress incontinence. Urine leaks when you exert pressure on your bladder by coughing, sneezing, laughing, exercising, or even lifting something heavy. Next one, urge incontinence. You have a sudden intense urge to urinate followed by an involuntary loss of urine. You may need to urinate often, including throughout the night. Urge incontinence may be caused by a minor condition such as infection or a more severe condition such as neurologic disorder or even diabetes. Next type, overflow incontinence. You experience frequent or constant dribbling of urine due to a bladder that does not empty completely. Next type, functional incontinence. A physical or mental impairment keeps you from making it to the toilet in time. For example, if you have severe arthritis, you may not be able to unbutton your pants quickly enough. Next type, mixed incontinence. You experience more than one type of urinary incontinence in this type. Then let us know the most important thing, warning signs and symptoms. You may feel uncomfortable discussing incontinence, but if incontinence is frequent or is affecting your quality of life, it's important to seek medical advice. It's important because urinary incontinence may indicate a more serious underlying condition. In the same way, urinary incontinence may cause you to restrict your activities and limit your social interactions. In the same way, urinary incontinence may increase the risk of falls in older adults as they rush to the toilet. Now, the most important of this topic, causes. Urinary incontinence is not a disease, it's a symptom. It can be caused by everyday habits, underlying medical conditions, or even physical problems. A thorough evaluation can help determine what's behind your incontinence. Now, let us know something about the classification. Basing on the duration of the symptoms, urinary incontinence can be classified into two types. They are temporary urinary incontinence and persistent urinary incontinence. Let us know something about these two types. First one, temporary urinary incontinence. Certain drinks, foods and medications can act as diuretics, in the sense stimulating your bladder and increasing your volume of urine. These include alcohol, caffeine, decaffeinated tea and coffee, carbonated drinks, artificial sweeteners, corn syrup, foods that are high in spice, sugar or acid, especially citrus fruits, heart and blood pressure medications, sedatives and muscle relaxants. Not only this, large doses of vitamins B and C can cause this problem. And urinary incontinence also may be caused by easily treatable medical conditions. These conditions include urinary tract infection. Infections can irritate your bladder, causing you to have strong urges to urinate and sometimes incontinence. Other signs and symptoms of urinary tract infection include a burning sensation when you urinate and foul smelling urine. In the same way, constipation. The rectum is located near the bladder and shares many of the same nerves. Hard, compacted stool in your rectum causes these nerves to be overactive and increase urinary frequency. Now, let us know the second variety, persistent urinary incontinence. Urinary incontinence can also be a persistent condition caused by underlying physical problems or even changes. These include pregnancy, hormonal changes, and the increased weight of the uterus can lead to stress incontinence. The other one, childbirth. Vaginal delivery can weaken muscles needed for bladder control and also damage bladder nerves and supportive tissue, leading to a dropped or prolapsed pelvic floor. With prolapse, the bladder, the uterus, the rectum or even small intestine can get pushed down from the usual position and protrude into vagina. Such protrusions can be associated with incontinence. Next, changes with age. Aging of the bladder muscle can decrease the bladder's capacity to store urine. And menopause. After menopause, women produce less estrogen, a hormone that helps keep the lining of the bladder and urethra healthy. Deterioration of these tissues can aggravate incontinence. Next, hysterectomy. In women, the bladder and uterus are supported by many of the same muscles and ligaments. Any surgery that involves a woman's reproductive system, including removal of the uterus, may damage the supporting pelvic floor muscles, which can lead to incontinence. Next, enlarged prostate. Especially in older men, Incontinence often stems from enlargement of the prostate gland, a condition known as benign prostatic hyperplasia (BPH). In the same way, prostate cancer. In men, stress incontinence or urge incontinence can be associated with untreated prostate cancer, but more often incontinence is a side effect of treatments for prostate cancer. Next, obstruction. A tumor anywhere along your urinary tract can block the normal flow of urine, leading to overflow incontinence. Urinary stones, that is hard stone-like masses that form in the bladder, sometimes cause urine leakage. In the same way, neurological disorders, multiple sclerosis, Parkinson's disease, stroke, a brain tumor, or a spinal injury can interfere with nerve signals involved in bladder control, causing to this urinary incontinence. Now, the most important thing, risk factors. There are certain factors that increase your risk of developing urinary incontinence. Let us know one by one. First one, gender. Women are more likely to have this stress incontinence. Pregnancy, childbirth, menopause, and normal female anatomy account for this difference. However, men with prostate gland problems are at increased risk of urge and overflow incontinence. Next risk, age. As you get older, the muscles in your bladder and urethra lose some of their strength. Changes with age reduce how much your bladder can hold and increase the chances of involuntary urine release. Next risk, being overweight. Extra weight increases pressure on your bladder and surrounding muscles, which weakens them and allows urine to leak out when you cough or sneeze. And in the same way, other diseases. Neurological disease or diabetes may increase your risk of incontinence. Now, let us know something about complications. If neglected, complications of chronic urinary incontinence may arise. Let us know these complications. First complication, skin problems. Rashes, skin infections and sores can develop from constantly wet skin. In the same way, urinary tract infections can be the complication. Incontinence increases your risk of repeated urinary tract infections. In the same way, impacts on your personal life can be a complication. Urinary incontinence can affect your social, work and even personal relationships. Okay, now let us know something about tests and diagnosis. It's important to determine the type of urinary incontinence that you have. This information will guide treatment decisions. Your doctor is likely to start with a thorough history and physical exam. You may then be asked to do a simple maneuver that can demonstrate incontinence. How you do it? Close your mouth, pinch your nose shut and exhale hard. If you experience urine leak, then you have a real problem. After that, your doctor may recommend some tests. These tests include urinalysis. In this, a sample of your urine is checked for signs of infection, traces of blood or other abnormalities. In the same way, bladder diary. For several days, you record how much you drink, when you urinate, the amount of urine you produce, whether you had an urge to urinate and the number of incontinence episodes. In the same way, post-void residual measurement. You are asked to urinate or void into a container that measures urine output. Then your doctor checks the amount of leftover urine in your bladder using a catheter or ultrasound test. A large amount of leftover urine in your bladder may mean that you have an obstruction in your urinary tract or a problem with your bladder nerves or even muscles. In the same way, urodynamic testing. A doctor or nurse inserts a catheter into your urethra and bladder to fill your bladder with water. Meanwhile, a pressure monitor measures and records the pressure within your bladder. This test helps measure your bladder strength and urinary sphincter health, and it's an important tool for distinguishing the type of incontinence you have. In the same way, cystoscopy. Your doctor inserts a thin tube with a tiny lens into your urethra. Your doctor can check for and possibly remove abnormalities in your urinary tract. In the same way, cystogram. Your doctor inserts a catheter into your urethra and bladder and injects a special dye. As you urinate and expel this fluid, X-ray images of your bladder help reveal problems with your urinary tract. In the same way, pelvic ultrasound. Your urinary tract or genitals are checked for abnormalities with this test. Now, let us know the limitations and consequences of allopathic medicine. For urge incontinence, general practitioners often prescribe anticholinergics such as oxybutynin, tolterodine and propionine to relax the bladder. These also come with a raft of serious side effects, many affecting the heart, and they can make an overactive thyroid worse and cause heat, prostration and hiatal hernia, in addition to dry mouth, constipation, blurred vision and even drowsiness. Then there are certain guidelines and suggestions in this condition. Treating incontinence early could spare you from major surgery or even drugs. There are certain alternatives and Ayurvedic recommendations. Let us know these recommendations. Bladder training. This is to delay urination after you get the urge to go. You may start by trying to hold off for 10 minutes every time you feel an urge to urinate. The goal is to lengthen the time between trips to the toilet until you are urinating only every 2 to 4 hours. In the same way, double voiding. This is to help you learn to empty your bladder more completely to avoid overflow incontinence. Double voiding means urinating, then waiting a few minutes and trying again. In the same way, scheduled toilet trips. This is to urinate every 2 to 4 hours rather than waiting for the need to go. This is the most important thing. And in the same way, fluid and diet management. This is to regain control of your bladder. You may need to cut back on or avoid alcohol, caffeine or acidic foods. Reducing liquid consumption, losing weight if you are overweight, or increasing physical activity also can ease the problem. And the most important one, pelvic floor muscle exercises. This is the most important topic. These are to strengthen the muscles that help control urination. These techniques are especially effective for stress incontinence but may also help urge incontinence. To do pelvic floor muscle exercises, imagine that you are trying to stop your urine flow. Then tighten or contract the muscles you would use to stop urinating and hold for 5 seconds and then relax for 5 seconds. If this is too difficult, start by holding for 2 seconds and relaxing for 3 seconds. Work up to holding the contractions for 10 seconds at a time. Aim for at least 3 sets of 10 repetitions each day. And pads and protective garments. These are also important. Most products are no more bulky than normal underwear and can be easily worn under everyday clothing. Men who have problems with dribbles of urine can use a drip collector, a small pocket of absorbent padding that's worn over the penis and hold in place by close fitting underwear. And use of catheter. If you are incontinent because your bladder does not empty properly, your doctor may recommend that you learn to insert a soft tube, that is catheter, into your urethra several times a day to drain your bladder. You will be instructed on how to clean these catheters for safe reuse. Now let us know the lifestyle modifications. Problems with urine leakage may require you to take extra care to prevent skin irritation. In the same way, to avoid this, use a washcloth to clean yourself. Allow your skin to air dry. Avoid frequent washing and douching because these can overwhelm your body's natural defenses against bladder infections. Consider using a barrier cream such as petroleum jelly or cocoa butter or jatyadi ghritam to protect your skin from urine. If you have urge incontinence or nighttime incontinence, make the toilet more convenient. Move any rugs or furniture you might trip over or collide with on the way to the toilet. Use a night light to illuminate your path and reduce your risk of falling. If you have functional incontinence, you might keep a bedpan in your bedroom. You might install an elevated toilet seat and you might widen an existing bathroom doorway. To help decrease your risk, maintain a healthy weight. Practice pelvic floor exercises, especially during pregnancy. Avoid bladder irritants such as caffeine and acidic foods. Eat more fiber, which can prevent constipation, a cause of urinary incontinence. Now let us know something about Ayurvedic remedies. These are excellent home remedies you can try. Just make a decoction of mixture of rasaunt 1 gram, amla 5 grams and sont 1 gram and drink. Another excellent home remedy. Drink decoction made from 75 to 100 grams sesame seeds. Another excellent home remedy. Drink decoction from 10 grams kulanjan. This you can procure from Ayurvedic store. In the same way, another excellent remedy. Swallow pill containing 900 milligrams Zaifal and 100 milligrams camphor. Another remedy. Swallow Shilajit 250 milligrams and Triphala 10 grams with honey. Another excellent remedy. Take Shilajit, Ilaichi, Vamsalochan in equal quantities. Make pills of 250 milligrams. Swallow 2 pills with decoction made from 10 grams Gokshura in 200 milliliters of water. Another remedy. Pulverize Shilajit 20 grams, Vijay Sar 40 grams, haldi 20 grams, methi beej 40 grams. Consume 2 grams powder with decoction of 10 grams jamun gulati, that is seeds, in 200 ml of water. This is all about the home remedies. Now let us know something about Ayurvedic drug treatment. Please keep in mind that these are all common home remedies and first aid measures. If the problem continues, even after using these remedies, you need to come for the personal examination and Ayurvedic body type evaluation. In Ayurveda, there are excellent and powerful medicines for this condition. The best suitable drugs are selected basing on your individual body type and prescribed along with the personalized diet and lifestyle modifications. So, hope you have enjoyed this topic and enlightened. In the next program, we will be meeting with another interesting and important topic. Shatam Jiva Sarado Vardhamanaha. Shatam Hemantan, Shatam Vasantan. Live your entire life with excellent health and total happiness. Take care of yourself. Subham.
Dr. Chirumamilla Murali Manohar, MD, Ayurvedam, Raksha Ayurvedic Center, Sardi Studios Road, opposite State Home, Amirpet, Hyderabad 73. Phone 9177445454.